Thank you so much. I am Nahashan Marebe. I work for Nairobi County. I coordinate RAB services. Part of my work is diagnostics, and we had quite a number of things we were doing in terms of COVID testing and mass testing for this exercise. Now, mass testing is where a number of people in their boards, where they live, will go there, and the majority of them would be requested to come up for testing. We were using the health promotion officers in the regions. We did this quite in a number of areas, that is around Kawangwale, around Isiri, around the CBD, areas where COVID had hit. We were looking at the hotspots for COVID, and we could do. So mass testing is testing people en masse, testing people in groups and in drives, and we could do this. We had teams that were doing this exercise. We were looking at the data that was being generated from the facilities, and we had one of the questions in the questionnaire is, where do you live? Where do you come from? So majority of the people would come from an area, and that data would be subjected to some data analysis, and it would show us that this area is having quite a number of people with COVID, and therefore then we would label that a hotspot, and that's where we could now task and then say, we need to visit that area and do some mass testing. The mass testing was open for the public, the general public. It was free testing, only that we were using the health promotion officers in the regions, and they would tell people of the dangers of COVID and the good of testing. We were selling the benefits of why we needed to test them. That when you get tested, we know how to isolate or quarantine you. So the public, the general public, was what we were targeting. Yes. Now, COVID is one of the emerging diseases. Initially, when we started testing for COVID and when we started having cases for COVID, people were fearing, why is so having such a bad flu, related to flu? Yeah. And then at that point, that worry made people to want to be tested. Yeah. And many of them would come and even come to facility and say, I want to be tested for COVID. I want to know whether I have COVID or not. But then during the whole process, there came some lethargy. And people would ask ourselves, why am I being tested? Even if I have COVID or no COVID, what benefit will it have to me? So people started now relaxing. And now to the healthcare worker. The healthcare workers initially were also very fearful of this new disease. And then having worked in our facility, and everybody is coming to you, the exposure was high. Yeah. So people are saying, now, I'm working in a health facility, and people are coming here with COVID. Mm-hmm. When they come with COVID, it means then, therefore, I am at risk of getting this disease. Mm-hmm. The mask and the sanitizations, the number of times we used to wash our hands, and quite a number of things could not be enough to really protect you from this contact sort of disease. So people used to fear a lot, and then say, wow, this disease might end up maybe killing me. So that could be the challenge. So people used to fear. Number one, there is the agenda of fear. And people fear what they don't know. And then the symptoms and the signs and symptoms of COVID were related to quite a number of other ailments that are with us. Yeah. So that became now the other thing. Anybody who got some flu, they would say, wow, this could be COVID. Yeah. And then the fear of the real sampling. Yeah. We used to have some... swabs, and the swab was wrong enough to go into somebody's nostrils, and then they could say that thing was a bit, it caused some discomfort in the nares, in the nostrils as we did this. So people could say, wow, this thing ain't one of the best things to have inside you. Yeah. So people could fear, even if they wanted to know the results, they could fear the swabbing process, that sampling process. Yeah, there was some lethargy from the public to come to testing. However, when people started dying, and much more so in big numbers, and then hunting for hospital beds, hunting for ICU beds, HDU beds, and literally some facilities never had good facilities to isolate COVID patients, the death toll took over, and many people died at that period. Now that is what now hit the people back, and they said, let me then know whether I have COVID or not. Because if I have COVID, I have no ways of protecting myself and protecting the others. But even then, people are still reluctant into being tested, because we are seeing they were saying that COVID doesn't have a real drug that you can take and then the virus dies. It was what we call maintenance, management. You manage the symptoms, you manage the fevers, you manage the flu, you manage quite a number of other things. You don't really kill the virus. So majority of the people want to say, even if I had COVID, then what benefit would that testing then have on me? But the death toll, yes, at one point when people died, quite a number of them, the public also became aware and they knew that this thing is then taking toll on us. So many of them came for testing. Many of them came for testing. At a personal level, COVID was really, let me say this, we had quite, personally had a big take in COVID. I also got COVID twice. The number of times I know I was tested and was found with the virus, I got COVID twice. And initially when we started testing, many people feared. We were called by the national government for trainings at both Naivasha, Machakos, and here in Nairobi. Many people feared to go, and they said my age wouldn't allow me to go and start testing people. So when we started testing, many people feared. But I volunteered myself and I said, I think this service, like any other, I need to take the best of the precautions that I need to do today to prevent myself from getting COVID. That never went well with me. I said this, I had COVID twice. But maybe I could have had COVID more than twice. But those 2 times are the ones I felt I was really challenged for that I couldn't walk out of my house. I had headache, I had fever, I had muscle aches, and I said, wow, this thing is on me. Now I called somebody who came and tested me in their house because we were also had the benefit of using rapid test kits by then, because it was nearly towards the middle of the outbreak. Mid in the outbreak, we had now the antigen test kits that were used to really look at whether somebody has the virus or not. So when somebody came, I and my family, 3 members were positive and 2 members were negative. So we had to isolate ourselves in our home, and I had to stay 3 weeks without even moving, without even coming to duty. But it was well with me. Yeah, it was well with me. So personally, I also got the disease. Okay. And then that's the time you realize, wow, this thing is real. Many people are saying COVID is something manufactured elsewhere and it's not a real thing. People are making whatever out of it. I don't know. But for me, I felt the brunt of the same when I suffered COVID twice. Now, COVID as a disease, what we realized as medical team or personally is that it was worse on people who had other pre-existing conditions. Things like high blood pressure, diabetes, or lowered immunity. COVID would really take them down very fast. So my luck maybe could be I never had any of those underlying conditions or that could have maybe saved me. Otherwise, it wasn't well. You could feel you really hit. If you find a man not working or leaving his home to go and fight for the family, then that was when you could realize that this thing is really a hit. It was really bad. Yeah. With some of these new viruses, you realize that you might not know when it is ending or when it has ended. They could give you a period of like 3 weeks. Rarely would you know whether you're still shedding the virus or not, because that was something that was continuous. And then the other opportunities are that you could be hearing and then you are still exposed. So you still could pick up another variant. So and another new infection starts all over again. So those were the challenges about diseases that are either contact or airborne, where you could touch things and then you have the virus with yourself. Even if you're in the process of healing, even if you are still taking medications, you still go down with the disease. So those are some of the most scenarios. Now, when COVID came, one of the biggest challenges we had was diagnostics. Yeah. Because we had only 2 sites that could do COVID then around Nairobi. I'm talking about Nairobi now. Yes. We had the National Public Health Laboratories, what we used to call the National Influenza Center. Yes. And then we had the Kemuri diagnostic arm that does the viruses, the viral diagnostics in Kemuri. So those are the only 2 sites we could do this. Then we never had the rapid test kits, which could tell us immediately in like 10, 15 minutes that you have COVID or not. Yeah. So those 2 scenarios were putting us in a very brunt end of this, the other very brunt end in terms of you have collected samples. There are only 2 sites where you could take them for testing. And those sites, they'll tell you, we have enough samples. We are full to capacity in terms of what we want to test for this week. Then results would delay. That to us was torture. Because imagine you had clients who you have sampled, and the clients know you. They don't know where you took the sample. So they will come to you asking for results. At that point, I know as well, we were also testing a lot of government institutions and parastatals. And the CEOs from those parastatals would now, they have your number. So they keep on calling you, where are our results? You tested us when you picked the samples on a Monday. This is Wednesday, still no results. What are we supposed to do with our staff? So that used to be a big challenge for us, where we took samples and they take like a week or 3-4 days without us getting the results back. So that would be a big challenge. Then in terms of isolation and quarantine, we had a few areas, and I know somebody would have talked this to you, but even taking samples from those quarantine and isolation centers was a challenge for us, because we will take the samples and somebody has finished their 10 or 21 days and we're expecting a result within 3 days, meaning they have to keep in their quarantine or isolation center longer than expected, and they will be calling on you and asking you, oh, do you want me to continue paying for this stay in this hotel, whereas it's you who is holding my results? So those could be the other challenge. And then people wanted to quarantine, and they said they would quarantine into their homes, but never ended doing the same. We still could find them hovering around in town, and we had identified that they had the virus. So that was another challenge in terms of public continuity for the dissemination of the virus. For information, that is now communication towards telling people what COVID is, how to protect yourself from COVID, hand washing. That information was with people. And we were happy about what people did. The wearing of the mask during that period was nice. The hand washing that was experienced during the 2020-2021 period was of high caliber. People really washed their hands, sanitization and all those. So people took precautions in terms of this. People took precautions in terms of either acquiring or not acquiring COVID. People took precautions, good precautions. So the information was there. And now, when you look at highly infectious diseases, COVID really shook the whole world. We've never had a disease that stopped the world from operations for that long period. At this time of innovations and quite a number of things that are there in terms of health management systems. So COVID really shook the world. But we've had other diseases equivalent to this in terms of infectivity and how the virus behaved. We've had Ebola in parts of Africa, that's the DRC, in terms of some parts of Uganda, in terms of Liberia and elsewhere. So Ebola is, in terms of infectiousness, would be worse, because it's what we call viral hemorrhagic fever. That is worse than COVID. But however, it has localized. It has localized in some areas where it gets the suitable environment for transmission. COVID doesn't want to have any of those suitable regions. It is everywhere. That's why it's a pandemic found all over the globe, all over the world. So COVID's lessons in terms of management were very high. So number one, you had to protect yourself from either acquiring the disease, and number two, when you had the disease, that localized isolation or quarantine was very important for us. So those were lessons learned, that when we get diseases similar to what we did, there are ways of protecting ourselves from the disease. But we have no similarities in this near future of what we got in COVID. We had others, avian flu, which is not as serious as this, because there is a link between the human body and the other vectors that handle the viruses that do cause avian influenza. So the COVID one was worse in terms of where it affected and the large scale pandemic. Yes. And COVID was. So at that point, the idea is there is no plane going to India, South Africa, Germany, the US, or wherever. So if you had COVID, you die in your country, you die in your county even, you die in your home. So the idea is then we need to make up for this. And that's how they started looking for, in my county, do I have ICU beds? In my county, can I do diagnosis for COVID? In my county, how prepared am I? So it was a awakening call to the politicians that what they needed to do is to invest more in health. And they did. The investments we are having, like here in Bagadi, in Mama Lucy Hospital, was courtesy of that awakening call. People realizing that if we have COVID or any other disease that could broke and tame the whole world to people staying in their houses, then this could be serious. So in terms of health systems, yes, we realize that they are positive things. One of them is we have now increased the number of diagnostic centers across the country, not only in Nairobi. And then the increase in numbers of the diagnosis is we also brought in kits that could test for COVID instantly. What I call instant could be 20 or 30 minutes. We don't need to wait for a day or two to get results. So we had rapid test kits. That was a plus in the health system. We never had these kits initially. And then for the bigger machines that were now doing polymerase chain reaction, we took call PCR, the big analysis for COVID, we got 2 centers in Nairobi for the public for free. And that was now Bagadi Hospital and Mama Lucy Hospital. For free, we could test for people. Now, with the big machines, we could be able to talk of the variants. We could be able to talk of, it's more sensitive and more specific towards the isolation, because number one, it does what's called polymerization. It increases amplification. It amplifies the number of viral copies in a sample. The rapid test might not amplify that much, but the big equipment would amplify the number of viral copies to make a good number, and then it could be able to tell whether somebody has a raw viral load of COVID than another one, and that the kids might not be able to pick that.
Okay.
Yes. Maybe the interesting part of this is that at times you'd go to an area and everybody wanted to be tested and you are not carrying enough materials to test. So that for us was a prize. People having that enthusiasm to come to stand in front of us, and we tell them, we're waiting for the more kids to come later, we will wait with you. So, and when they live there with the results, because for the rapid tests, we were giving results instantly. So we already tell somebody to wait for 20 minutes and they get their results. Now, that was, for us, that was a plus. And then the knowledge of that somebody has the virus, then when we tell them how to protect them from giving the virus to others, the cough etiquette, the hand washing, the sanitization, it came very well when you identify somebody has the virus. They picked that information very well. So that for us was a plus. The people are enthusiastic in terms of wanting to know, what do I do after this now, if I am positive?
Yeah.
Before the I said was on, earlier on, we were working very well with the community. The community was perceptive. They were positive towards, I have the virus, I have to protect myself, I have to protect my people from getting this. Yeah, this profession, in terms of diagnosis, I would say it was by choice that I decided to be a medical lab technologist by profession. I had the passion. Before I joined, I only knew they used microscopes.
Yes.
Only to realize that I could work without even a microscope in a lab, and I'm still churning out or giving results. So the passion to be in this profession, one, I liked biology and chemistry and physics in school, and mathematics because it's involved a lot in this. And then that passion found me in college, where I trained as a medical lab technologist, and then came out and went out to start this work. I started working in Marsabit. I worked there, I think, for 6 years, came back to Nairobi, worked in Madhare Hospital for another 6 or 7 years. I went to work at the spinal injuries. Then I came to the province, then Nairobi, and I am still with the county now, still doing this. But currently what I'm doing is less of diagnosis now. I'm doing coordination of laboratory work, making sure that they are capacity built in terms of information that they have, making sure that they have commodities, equipment, reagents that are used for testing as a whole, having to know that they are able to test due to them having reagents and equipment that are well serviced. That for me is now the passion that climbed on top of what I wanted to do personally. But if you remember what happened in countries like Brazil, France, Italy, the Americas, generally the Americas, and partly India, people dying in droves and even having no mortuaries and then doing mass graves, that never occurred much in Africa. Like in Kenya, we lost nearly, maybe, I don't have the correct data, but somebody should have, nearly 5,000 to 10,000 people only in that span. Those were COVID related. And I think that's what that was like an hour's death in terms of in some of those countries. In an hour, you could have 10,000 people gone. So in a day, you could have quite an, and people saw these statistics they were saying if Africa gets this dose, then we'll be wiped. The whole of African continent will be wiped.